Quickly we're going to see the benign tumors of the bone. This includes osteoma, osteoide osteoma, osteoblastoma, giant cell tumor, chondroma, and osteochondroma. So, the osteochondroma means bone and cartilage. So here we have an outgrowth of the bone here, and it is surrounded by a fibrous cap of cartilage. This occurs on the metaphysis. So this is the metaphysis of a long bone, usually on the knee, so would be on the distal femur or proximal tibia. Rarely, this cartilage can convert into a chondrosarcoma, and this is seen mostly on patients, men, usually before 25 years of age. Now, the osteoma, this is associated with Gardner syndrome, in which we have soft tissue tumors and osteomas, and this occurs on the fascial bones. Osteoide osteoma is a tumor that produces bone, so we have the osteoblast on the trabeculae, etc. On the radiograph or the chest, the X-ray, we will see a radiolucent cord that is the osteoid, and this is associated with a very important clinical presentation, that is pain at the night in a patient younger than 25 years of age, and the pain resolves with aspirin, and the size of the tumor is less than 2 centimeters. This in comparison to osteoblastoma, in which the histological characteristics are mostly the same, but the osteoblastoma has a more than 2 centimeters on size, and it is not responsive to aspirin or NSAID. The chondroma, this is the benign tumor of the cartilage, of chondrocytes that produce the cartilage. Here we can have chondromas. We can have something called hereditary exotosis. Exotosis is the same as a lot of chondromas. And we can have some syndromes associated with the chondromas, that would be Maffucci, that is associated with also hemangioblastomas, etc. These occur most often on the small bones, like on the hand and feet, on the medulla or bone marrow of those bones, and they have a popcorn appearance and some calcification, stippled calcification. Alright, now the giant cell tumor. This is benign. Well, we consider it benign, but it can metastasize to the lung. Here we could see hemorrhage, necrosis. This occurs on the epiphysis of the long bones, and here we have overexpression of the rank ligand. So this is on the osteoblast, but it will induce the proliferation of the osteoclast. So this is also called a osteoclastoma. And we could also see some bone forming, etc. And we will see soap bubble appearance on the X-ray, and also the recurrence of this tumor is quite common.